today we'll see about bite wound infections. So here we're going to see about dog bites, cat bites, the lab human bites, the lab diagnosis of bite infections and the agents causing bite infections. So first we'll see the clinical manifestations of bite wound infections. The lodging of organisms on the wound surface will occur, and sometimes due to the breach in skin barrier deeper penetration of the organisms can occur to the bones and joints. If it moves to the bones and joints, it can cause osteomyelitis and septic arthritis. If there is invasion into the lymphatics, it can cause bacteremia leading to meningitis affecting the brain, meningitis and brain abscess, and can affect the heart leading to endocarditis in cases of mostly occurs in cases of immunocompromised individuals. And the infection can also cause infection of cutaneous nerves, causing lodging of organisms to the CNS, example in case of rabies. Now we'll see about dog bites. The dog bites are most common bites in about 80, it's seen about 80% of the individual cases of bites. The infectious forms are only 15 to 20%. Out of these 80% bite infections, only the 15 to 20% are infectious. Age in it occurs in children more than adults, and it occurs in males more than females. Site of infection, mostly the site of bite, mostly the upper extremity. In less than 4 years of age, it may be seen in head and neck. The organisms involved in bite wound infections include aerobic organisms like beta hemolytic streptococci, Pasteurella, Staphylococcus, Eikenella corrodens, Capnocytophaga, Canimorsus. Anaerobic organisms such as Actinomyces, Fusobacterium, Prevotella, and Porphyromonas. Examples of dog bite infections includes rabies and tetanus. Now we'll see about cat bite infections. Cat bite infections are less common than the cat bites are less common than dog bites, but the infection is more in case of cat bites. The infection is about more than 50%. Gender, it occurs in women more than men, and it is higher. There is higher risk of penetrating injuries in case of cat bite infection, such as reaching the bone causing osteomyelitis or reaching the blood causing septic arthritis. The organisms seen in cat bite infections are Pasteurella multocida, Bartonella hensleyi, tularemia, Staphylococcus aureus, anaerobes, or it causes rabies or tetanus. However, these are rare. Human bites, it becomes infected in about 10 to 15% of the cases. There are two types of human bites: occlusional and clenched fist bites. So occlusional bites are the actual biting, whereas clenched fist bite refers to the fist of one individual will strike the teeth of the other individual. That is not an actual bite, but just the striking of teeth of other individual with the fist of one individual. But occlusional bites refer to the actual biting of the human. So clenched fist bites are more common than occlusional, and it leads to deeper infections. The organisms seen in human bites include aerobic such as Streptococcus, Staphylococcus aureus, Eikenella corrodens, Haemophilus influenzae, anaerobic such as Fusobacterium, Prevotella, Porphyromonas, and Peptostreptococcus. The other bites include rat bite, snake bite, old world monkeys, seals, walruses, polar bear bites, etc. So the rat bites, it is seen in Streptobacillus moniliformis, Leptospira, and bacteria and Pasteurella. We have discussed in detail about rat bite fever in another video. Snake bites, it is seen in Pseudomonas, Proteus, Clostridium, and Bacteroides fragilis. We can remember this by PCB. This PCB will cause snake bites. Old world monkeys, herpes simiae. Herpes virus simiae causes old world monkey bite infections and can lead to serious infections of the CNS. Seals, walruses, and polar bear bites can lead to seal finger. In this chronic suppurative infection can occur by Mycoplasma fococerebrale. Now we'll see the lab diagnosis of bite wound infections. The specimen collected would be a purulent exudate aspirated from the depth of the wound or wound swab. So, wound swab is the most common specimen collected, or purulent exudate from the wound can be collected, or any surgical incision can be collected. If there is any debridement or drainage from any kind of tissue, that tissue is surgically removed and it can also be used for lab diagnosis. But the most common specimen is wound swab. This specimen is subjected to gram staining culture. So this gram staining, we'll see, will differentiate the organisms based on gram staining, gram positive, gram negative, bacillus, cocci, etc. And culture in aerobic organisms, at least three cultures must be done, which includes blood agar, chocolate agar, and McConkey agar. Anaerobic culture must be done only if anaerobic organisms are indicated. In cases of abscess, foul smelling exudates, or devitalized tissues, if these things are present, then it may be due to an anaerobic organism. So, anaerobic culture is done in these cases. The agents of bite wound infections are Pasteurella, causing pasteurellosis, and Capnocytophaga infection. So first is Pasteurella, pasteurellosis. So pasteurellosis is caused by Pasteurella multocida. The clinical features includes the bite area will become red, swollen, painful with low grade fever, and regional lymphadenopathy may be seen. In severe cases, bacteremia is seen, which can lead to osteomyelitis, meningitis, endocarditis, and etc., which we have already seen in clinical manifestations. Lab diagnosis, it is done by gram staining. In gram staining, gram negative coccobacillus is seen, and in culture, it readily grows in culture. The identification, normally it may be done by biochemical ways or by automated methods. In automated methods, Malditoff and Whitech will be used. The treatment of pasteurellosis includes penicillin G and amoxiclav. Amoxiclav is amoxicillin clavulinate. Capnocytophaga infections. The capnocytophaga infections are generally caused by Capnocytophaga ochrysea, Capnocytophaga gingivalis, and Sputigena. The clinical features will include periodontal disease, sepsis, and meningitis in case of immunocompromised individuals. It can also cause fulminant septicemia. It is seen mostly in case of Capnocytophaga canimorsis, which is generally caused by dog bite infections. In dog bite infections, fulminant septicemia can also be seen. The risk factors includes heavy alcohol intake. So, because of heavy alcohol intake, there will be liver cirrhosis. So, liver cirrhosis is also a risk factor, and immunocompromisation in individual. So, lab diagnosis, it is by gram staining, culture, and identification. Gram staining, in this also the gram negative coccobacilli is seen, which may be fusiform or filamentous. In pasteurellosis, it is gram negative coccobacillus. This also it is gram negative coccobacillus, but fusiform or filamentous forms may be seen. It is capnophilic. It requires carbon dioxide, so it grows in enriched media only. In blood agar, it appears as orange pigmented colonies, and it shows a slow growth. Identification, it may be by automated methods such as Malditoff, Vitek, or by biochemical tests. Treatment is by ampicillin sulbactam, which is the drug of choice for capnocytophaga infections. Thank you.